The COVID-19 crisis has shone a spotlight on three of the fundamentals of using law for health. First, our interdependency. Second, the responsibility we owe to the most vulnerable among us. And third, our global interconnectedness. First, the crisis shows us graphically that our health and well-being, and indeed our lives, are inherently interdependent. This is true at all times, but we don't usually experience it this acutely. We've quickly come to understand our and others' roles and responsibilities as spreaders or potential spreaders of the virus, and as having individual needs of a health system that has finite capacity in personnel, in equipment, and in money. What we do affects others enormously. This is what law for health is really about, regulating the behaviour of interdependent people. We're capable of both doing enormous good for one another and significant harm, whether deliberately or unintentionally. Second, we owe particular responsibilities to the most vulnerable among us. We're seeing this in our awareness of the susceptibilities of older members of our community and people with pre-existing health conditions to the virus itself, and the need to take particular care for them. But it's much more than this. It's also the effects of this extraordinary social and economic dislocation across our societies, which is being experienced differently by different people and groups. We've long known of the inequalities in health, in who becomes unwell, and in access to treatment and ultimate health outcomes. And this will over time likely play out in a similar manner for COVID-19. Individuals and families will have very different experiences depending on whether they have and are able to keep their jobs, have savings they can draw on, where they live, including whether they have a home, their gender, their ethnicity, the safety of their relationships, their mental health, whether they have any disabilities, and their social connections. While we feel we are in an extraordinary collective crisis, we don't actually experience it collectively or in the same way. This is another of the imperatives of public health and of law for health. At the same time as trying to do the best for the health of the entire population, we need to look after the most vulnerable. Third, we are globally interconnected, and we always will be. Obviously, we've seen this as the virus has spread as people have moved across borders, but we're seeing both the connections and the disruptions to connections in many other ways. Countries are holding on to essential medical supplies that are urgently needed by other countries. Masks, gowns, gloves, sterilisers, ventilators. Global supply chains have been upended. The norms of international trade have been smashed. At the same time, scientists are working across countries to track and understand the virus, to share their experience in controlling it, and to develop a vaccine as soon as possible. Countries are closing their borders and focusing on protecting their own people. While this is understandable in modern political systems, we cannot lose sight of the situation in other places, particularly those where health systems and social and economic support systems are least able to respond to the crisis. In Australia's case, in particular in the Asia-Pacific region. We need to be thinking both about the decisions we are making now and about how we are going to put this all back together. There are and will continue to be immediate tests. Are medical equipment and supplies going to get to the places they are needed when they are needed? Who gets treated when the health system can't treat everyone? When we develop a vaccine, as we all hope we will, who's going to get it and how soon? How much will it cost? Will some countries be left behind? Recovery from COVID-19 is going to take a long time, both for individual countries and globally. We won't go back to how things used to be. At the same time as focusing on the immediate health crisis, we need to be thinking about the values that will guide us through the difficult times ahead as both national and global citizens, and about the legal and regulatory frameworks and capacity that we'll need to get us through them.